You know the feeling of leaving a medical appointment. Sometimes you walk out feeling anxious, entirely dismissed, and somehow smaller than when you walked in. But other times you leave a different doctor's office feeling profoundly safe and completely understood. Imagine two hypothetical doctors. They went to the exact same medical school, they hold the exact same degrees, they even practice their specialty down the hall from one another in the exact same hospital. Yet, despite having identical clinical training, these two professionals generate completely different emotional realities for the people they treat. We assume that efficiency, deep medical knowledge, and a polished bedside manner are enough to ensure good care. However, professionalism on its own lacks the mechanics to guarantee emotional safety. To understand why, we look to Dr. Shungu M'gadzah's 6 stages framework. This gives us a lens to measure how well a professional actually handles human complexity, intense emotion, and the hidden power dynamics inside an examination room. The framework suggests that the anxiety felt after a dismissive encounter is a direct result of the doctor's own emotional baseline, rather than a reflection of the patient's condition. Let's walk into the first office. This is a stage -2 professional. From the outside, they look great. They are fast, highly confident, efficient, and widely respected by their peers. But beneath that polished exterior operates a deep discomfort with being challenged and a rigid need to maintain absolute control over the room. Because of this internal defensiveness, standard questions from a patient register as direct threats to the doctor's ego. To neutralize these threats, they deploy specific verbal tactics. You'll hear things like, "You're worrying too much," or claims that Google is just making everyone anxious. When managing a patient's feelings is viewed as an inconvenience, the doctor often minimizes cultural differences, overlooks their own personal biases, and dismisses valid physical pain. The patient sitting on the exam table is left feeling silenced, ashamed, and physically smaller than when the appointment began. This consultation is a transaction designed to protect the doctor's authority. It prioritizes the professional's comfort over the patient's needs, which actively destroys the patient's willingness to seek care in the future. Now, let's rewind and walk into the second office. This is a stage +3 professional. They possess the exact same level of medical expertise and decision-making authority as the first doctor, but their foundation is entirely different. They lead the entire interaction with active curiosity rather than ego-driven defensiveness. Faced with the same set of questions, this doctor views them as vital opportunities to build connection and find clinical clarity. They actively invite the real world into the room, prioritizing an understanding of your cultural background, your current emotional state, and your lived experience. You will hear phrases that actively invite collaboration. They say things like, "Help me understand what's worrying you," or "Tell me more about how this is affecting your life." The patient leaves feeling calmer, deeply respected, and treated as an active participant in their own healing process. Empathy actively changes the experience of healthcare. Even a difficult medical diagnosis becomes manageable when the person receiving it feels psychologically safe. These two approaches produce different long-term outcomes. When patients are consistently shut down, their willingness to engage becomes brittle, leading to fragile compliance. In contrast, the safety felt in a stage +3 room builds the foundation for trust that lasts far beyond the initial appointment. This trust is a critical factor in a patient's ongoing engagement with the medical system, which directly shapes their long-term health outcomes. So, the next time you sit in a clinic waiting room, evaluate the interaction. Ask yourself, did this appointment expand my sense of trust, or did it shrink it? A sense of being dismissed says everything about the professional's stage -2 world, and nothing about the validity of the patient's concerns. A patient will eventually forget the exact medical terminology of their diagnosis, but in the end, they will never forget the physical memory of how safe or unsafe that